I would like to start off by acknowledging that the Georgian Fayee Center for Healthcare Innovation in Winnipeg is located on Treaty 1 land, home of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene peoples, and homeland of the Métis Nation. In coming together today, we respect the treaties that were made on these territories. We acknowledge the harms and mistakes of the past. We recognize the ongoing present-day colonial violence that is faced by Indigenous peoples within healthcare, education, justice, child welfare, and government systems. And we dedicate ourselves to moving forward in partnership in a spirit of reconciliation and collaboration. And when we are talking about patient engagement, it is our belief that it must be rooted in social justice and committed to achieving true systemic change and health equity. A couple of disclosures, since we are an accredited program. I am employed by the Center for Healthcare Innovation, as is Carolyn. Our partners are provided with honorariums for their contributions, and some also receive compensation for participation in other engagement activities outside of CHI and the Manitoba Primary and Integrated Healthcare Innovation Network, or MPN. So by the end of our session today, we hope that our attendees, you will be able to describe what hybrid engagement is or what that could be in your own context. We would like you to be able to discuss with patient and public partners in your own work the pros and cons of hybrid engagement for your specific context, and also discuss important considerations for hybrid engagement with patient and public partners in your own work. So having those conversations. And I will just do a quick slide here, just to make sure we're all on the same page. When we say hybrid engagement, what we mean is some combination of in-person and virtual modes of coming together. So it's probably a spectrum from completely in-person to completely virtual, somewhere in between, depending on your context. And the mode that you select will really depend on various factors: access to technology services, yourself and your partners, the type of engagement activity or participatory approach you plan to use or hope to use, and how well that adapts to different in-person or virtual modes of communication. And then what type of accommodations and other needs are required for meaningful engagement. And a note that our presenters, we've all talked about this, that good facilitation is going to be really critical for this. But our presenters today are going to talk a bit more about, we're going to back up a bit and talk about how to have these conversations. And so I would like to begin by introducing our panelists. We have Paula O'Recklin, who is a member of CHI's Patient and Public Engagement Collaborative Partnership. She's also a member of the Winnipeg Regional Health Authority's Patient and Family Advisory Committee, Shared Health's Patient and Family Advisor Network in Manitoba and its Advisory Committee, the Canadian Agencies for Drugs and Technologies in Health Patient and Community Advisory Committee, Patients for Patient Safety Canada, Healthcare Excellence Canada, Patient Advisors Network, and Health Technology Assessment International's Patient and Citizen Involvement Interest Group. She's recently taken InHealth Associates Foundation's in Patient Leadership Program. She's also co-author of a poster being presented at the Health Technology Assessment International Annual Conference that has been nominated for a prize. Annabelle Scott is the owner of Pilates Manitoba. She is trained in 3 methods of neurofascial exercising, Reformer Pilates, Melt, and Eldua methods for both medical and fitness use. She is currently in the 2nd year of a master's level diploma, Integrative Medicine and Healthcare program at the National Centre for Integrative Medicine in the UK. And Thomas Beaudry, who is also a member of our collaborative partnership, is a proud Indigenous man, a proud father of 3, 2 young men and a young woman, and a mushroom of 2 boys. He's a graduate of the Center for Indigenous Environmental Resources with a certificate in environmental protection, with the focus on environmental related issues concerning Indigenous peoples and communities. Thomas is currently employed with the province of Manitoba, Department of Sustainable Development, as an engagement and reconciliation community coordinator. His goal is the collaboration between environmental and healthcare fields by being a bridge, a facilitator in these fields, and with Indigenous people in order to assist with creating a way for healthy people and communities. So welcome, the three of you. Thank you so much for taking the time to be with us. And I'm going to turn it over to Paula.
So, as you hear from my biography, I have taken as much opportunity as possible from the ability to engage online. So, I have a severe chronic pain disease called complex regional pain syndrome. This means everything hurts my leg, especially things like Winnipeg's notoriously terrible roads. Before the pandemic, I would literally make a point of getting to places a half hour early just so the pain would go down enough to have a chance at participating in whatever I was doing. I would take a lot of extra medication and then suffer the effects afterwards, often for many days. I certainly couldn't go out multiple days in a row, or even more than a few times a week most of the time. Today, I'm able to take part in multiple meetings every day of the week. It's such a massive jump in the amount I'm able to participate that I've done more in the past 2 years than I have since I was in school. I'm still limited in what I can do, and I'm definitely still not able to have anything like a real job, but I'm able to take part in so much more than I honestly ever even dreamed. It's weird that a horrible pandemic has made such a positive change in my life, but it honestly has when it comes to engagement. I'm able to do more things that I never even imagined I could join so many things or accomplish so much. I've been able to speak at conferences and workshops like this, work with groups across the country and the world, write pieces for webinars like today. And that's just so much easier to do when multiple days a week, when it's just so much easier now than when multiple days a week were written off after going out once. But you don't need me to sell you on virtual engagement. We know it works. We've seen it over the past 2 years. Patients can be part of so many more things once technological barriers are dealt with. Now, those are very high barriers for some people, but most people watching this will have discussed things like giving patient partners access to electronic devices a long time ago. So now we're looking at opening up and hybrid participation after 2.5 long years. In a way, I'm worried about what will happen once things become hybrid. Right now, I'm able to participate in the exact same way as everyone else. But once people start going into meetings, is that going to change? I mean, am I going to be disadvantaged? Will I be back in grade 8 sitting on the side of the lines of the gym while everyone else does things? Unfortunately, when it comes to some things, I'm a little worried that might be the case. I had originally intended to speak only about the many surprisingly positive things about working virtually and how hybrid work is fantastic. And it is. Don't get me wrong. It's essential if you don't want a lot of the voices that have been able to speak up to be silenced. Personally, if I don't have to go to meetings, I'm not going to. I'd like to meet the people at CHI at some point in person, but I'm not going to go across the city from regular meetings anymore. So how will hybrid attendance shake things up? As I said, was planning to strictly praise it, but the more I participate in hybrid events, especially big ones, the more I get a little bit uneasy. So for meetings, I think it's going to be okay once we adapt to it. The people attending in person can't do all the speaking. I don't want the people with their digital hands up to never have a chance to talk, because those in person just have a more normal, natural conversation. But it's a pretty solvable issue, though, be it by having the chairperson make sure to focus on the screen and call on us, or just have the video on a big screen at the front of the room, no one's back to it, so everyone can see it, and we have a visibly large presence, and so people naturally pay attention to us. I'm sure there's going to be plenty more ideas I developed over the next year or so, much as we did in the first place going online. But it's for larger events I'm more concerned. I found that virtual conferences work really well for some things like panels, presentations, and some discussions. Having a clear, assertive person facilitating the event is definitely essential. I also find there to be a difference between webinars, where only the speakers and not attendees are visible in the video call, versus Zoom meetings like this, where everyone can see each other, speakers and attendees alike. You get the experience of actually being in front of the crowd with the latter, but the former can be less stressful. If you have a concern about speaking to audiences, I find it isn't really the same kind of an issue in a webinar, since it just looks like it's you and the other speakers in the meeting. But it does cut you off from the larger group of viewers, and you only hear what the audience has said or asked when the facilitator brings it up for the speakers to respond. If a connection with the audience isn't important to a speaker, that's a very big deficit. And now with hybrid attendance, this odd, half cut off experience from the audience is going to get even odder. I don't really know how it's going to work. For some people sitting in the room, there will be an obvious physical audience. For those online, it'll seem like they're in a meeting with a few other speakers. Or the digital attendees will be the only one to see the chat with all the virtual audience and their comments. The speakers in person will only hear what the facilitator reads from the chat, not the entire online conversation. It's just going to be this odd mix of experiences, more than there has been since the start of virtual work. So to eliminate this, you can have a camera on the physical audience as well as one on the speakers to give a better sense of being there for the virtual audience. To ensure everyone at the event in person sees what's going online, have the big screens up visible to both the in-person speakers and their audience so everyone can see the virtual speakers and attendees. The moderators will have to be sure to speak up when attendees write in the chat, though since it's pretty easy to ignore the relatively small type on the side of the screen. It might be awkward, but it should be manageable. Conferences need to work on some things like virtual booths and poster presentations. There are usually a fairly limited number of booths compared to pre-pandemic conferences. Then you go into them and there isn't the same kind of atmosphere. Starting conversations is often so awkward. Some conferences aren't even having the hybrid participants attend short things like poster presentations because of potential tech issues. I understand that some things might not really be possible when it comes to harmonizing real-time presentations and the occasional freezing or disconnection because of internet issues, but I wish they would at least make the effort to try. When we were all online, things didn't always go smoothly, but the attempt was there. Networking is one of the most difficult things to manage. When you go into one of these booths, you have to click on individual people, and it can just feel so completely awkward when you don't have anything specific to say. It's weird to just use small talk to start, and it just feels very unnatural. Networking with fellow attendees can be equally grim, unfortunately. While it's entirely possible to do it online, it rarely feels the same. The chats tend to stay entirely professional and they end much quicker. There isn't the same flow of casual conversation that in-person attendance can foster. Some people will talk about these negatives, especially when it comes to networking, and say we should just go in person again. But I don't believe that this social awkwardness is remotely important enough to outweigh the million reasons why virtual attendance works for so many people. Certainly, some people do better in person, and they should absolutely have the chance to go back to that, COVID depending, of course. But personally, what's even the point of to try to network when I'm in too much pain to think or talk? I'm not going to notice someone's body language if I can't even process what they're saying, because it just hurts too much. Ask people to turn on their cameras, if possible, and I'll actually pay attention to their expressions. Even without video, though, vocally you can get a decent sense of what someone is projecting. Just ask anyone without good vision. This is simply not a good enough reason to even consider not using hybrid models. So I believe that the only way forward is hybrid, unless you want to cut out all of the voices like mine. If anyone needs justification for putting the effort into having hybrid patient engagement, that's it. If you do not use hybrid methods, you will not engage people like me. Even if you forget disability, which is a pretty huge thing to forget considering we're talking about patient engagement, there's everyone who lives away from the major cities, everyone with kids at home, without childcare, all of those populations that suddenly got the chance to take part in things as long as they passed those digital barriers. But of course, other people suffered by not being able to get online easily, or they can't use electronics very well. So in-person is needed for those people. That means hybrid is simply and necessarily the only way forward. Anything else is going to cut out people who might otherwise be able to participate. It's so simple as that. Moderation skills are probably going to be the cornerstone of hybrid work. For smaller events or meetings, if people speak up when they have something to say, it'll probably work just fine. If people start putting their digital hands up and wait to be called on, while those in person just speak naturally when there are pauses, that's going to be a problem. So tell your virtual attendees not to be afraid to just start talking. Or if that doesn't work, then even those attending in person will need to put their hands up or otherwise physically signal they want to speak and wait for the chair of the meeting to call on everyone. This will probably be the case for bigger meetings. You can just start them off by discussing this. It's the larger events that'll be more difficult. Having someone there specifically to monitor the online attendance will help. If you have one person focus on running the in-person meetings as traditionally done, and another to interject and ensure the online audience has its time to speak and have their questions heard, this will smooth things out quite a bit. The size of the crowd, percentage of people in person versus online, number of speakers participating virtually versus in person, how often the audience is typing in the chat, the technical ability of the moderators, the number of technical problems. So many factors are going to impact this. Really, the best thing you can do when it comes to hybrid work is to do some trial runs before the event. Get dedicated tech support for the event too. Hybrid work is the only way forward if we want everyone to participate. It's worth the work that will be necessary to get it running smoothly. We all adapted to going online virtual in the last couple of years. We can, we must, we will do it again.
Fantastic. Thank you so much, Paula. And I think everything you brought up just emphasizes how important it's going to be to have these conversations in our own specific context, right? Because there's so many factors and they're so different for different people, the size of your group, the topic you're talking about, their own abilities or disabilities or needs. So yeah, thank you, Paula. Fantastic job. We got a bunch of applause emojis from the audience.
Thank you very much.
And so we'll have time for discussion at the end, but I'm gonna let the speakers go ahead. And so next I'm going to turn it over to Annabelle. So please, Annabelle, share your thoughts on in-person, hybrid, and virtual work.
Sure. Thanks so much, everyone. And Paula, thank you so much. I am nowhere near as concise as Paula. So I've had direct experience as both a participant and as a deliverer. Most of my work used to be done in person. And of course, everyone had to pivot online to get physical instruction or a mindfulness or breath instruction or physical movement instruction through to a wide range of different participants. And so from both perspectives, I do think we know it is a sign of the times and a good one to continue doing that. I think a lot of positives have been improved communication skills and improved facilitation skills on both parts. I've had even some more reluctant participants actually say they enjoyed not being there physically and that it was their time they could turn off their camera and say something if that's how they felt, rather than not saying it at all. So there were some experiences of that too. I've done it both individually in small group and going to school. So one thing I will say, when I was at school in May, if it had been non-COVID time, you would have been over physically in Britain, but it was also really a cost savings that you didn't have to go over, and it did work. It worked very, very well. But I do believe it goes back to Paula's comments. You have to be well prepared for it, good IT, good dedicated tech, and they could see us and we could see them. So it was well done. I also go to school with medical professionals, so they're used to telehealth. And if not telehealth, they're used to online medical attention. And they're very interesting to speak to too about their experience. I also work with secondary care practitioners like physios and OTs and ATs, and they would be very interesting to talk to too, but they're really able to deliver one-on-one with success as well. I sort of have two though mechanical comments to make. Insurance. So in my profession, we had to make sure that with some of the services we're delivering, some of the programs we're delivering, especially like a breathing one, some insurance companies are requiring that people's cameras stay on. The instructor has to see the person. You have to see them. You have to make sure they're not lying on the floor and that they can't get up. So I think that's a consideration. It's not a negative. It is certainly a mechanical business consideration that has to be looked at. And as well, we had to make sure that the people registered had given us their full name and a next of kin that could be easily especially working with seniors, by the way. So I'll put it in context. I was working with breathing, lung capacity, and mostly seniors, but mostly also incapacitated breathing or struggling breathing. So it's very clear that there were some insurance and liability and safety issues that had to be looked after. So park that idea and remember that too. If you are delivering that, we did require the camera to be on. We required that the person give us the next of kin. And if the instructor thought at any one time the person was not responding, we texted that person and they would be available to go in and help that person, or you call 911. So a consideration, park that idea. And then in the name of social justice and in health equity, working with populations that don't have access to computers and don't have access to internet. That is a huge consideration. And I could speculate on two ideas that have crossed my mind is, of course, there's no way that we can get a computer into everybody's hands, but I'm wondering if through facilitation through nonprofits, if it could be an extension of some of their offerings. So they bring 10 people who don't have access to a computer into a meeting and they do it there. So there's another positive discussion to be had about being able to reach people who otherwise might not have a voice in any context. You can make that in any healthcare setting or in a social justice setting. That idea has crossed my mind, that it's now another offering for certain nonprofits and that they're the contributors, they're the collaborators, they're the facilitators, and then researchers and other people can come online and talk to them. That is it for me. Yeah.
Thank you, Annabelle. I appreciate you sharing, especially having experience doing some online and hybrid work, whereas your specific context has always been in person, right? So I know it must have been a challenge for you to move, and then sharing from the perspective of what might need to be considered. Thank you so much, Annabelle. And I will now turn it over, last but not least, Thomas Beaudry.
Bonjour, Annie. Gida Gizege, Migizaki Anene, Nandishnakas. My colonial name is Thomas Beaudry. As an Indigenous person, I find this very fascinating that governments are really going towards this hybrid meetings. I guess I'm so honored that Paula and Annabelle shared the perspective. If I was not in the city, you would not see my face because I have poor satellite connection to what's going on. So when we talk hybrid, I always say it this way: it is for the haves and not the have-nots. We, as my position as an advocate, I push for governments to ensure that we have connection to the internet so we can talk like this to everybody. And if we're going to medical health, I heard just last week they expect us to go to a library to utilize the internet connection. Well, hello, First Nations do not have libraries. When one of our elders die, that is our library. So we have to be mindful of that. So when you're meeting, I was in a union business this weekend, and we are going to lobby the government to ensure all rural communities are connected to internet. Well, I had to stand up and interject and say, include Indigenous communities in that. The reason being is governments, may it be provincial or federal governments, don't look at us as Canadian citizens. And we don't look at ourselves as Canadian citizens. Canada was formed on us, on our lands and our ways. So we are looked at in regards to health as a number, not as a person. So it's easier for us to be looked at differently in regards to our health. So if we go in there and they have to talk to us by our name, we are considered human to them. So when we introduce ourselves like this or sit and talk on this, it's pretty hard because as Indigenous peoples, we are feelers. We have a hard time looking into people's direct eye contact. And people think we're shady if we're not really looking at you or towards you. Well, that isn't our way. Our way is about respect, listening. Two of these, two of these, one of these, and how we are going to listen. When we see people put up their hands, even in this, we feel the way we're taught to be mindful and respectful. They are first because we should not interfere with what their knowledge that they're going to bring. So if we don't interject and talk at these type of conferences or type of meetings like this, they think we don't know what is going on. So it's being mindful, it's being respectful when you're doing these hybrid things. It doesn't mean when you're working with Indigenous people that they don't know what's going on or not really listening to you. If I did this, you could still hear me, but you can't see me. Does it mean that I'm not paying attention? Does it mean that I'm not listening to you? If I was blind right now, I could not see you, but I could hear you. So we got to be mindful of that when we say all of these things. So as we go forward together in this new hybrid society, let's be mindful of how we are going to be inclusive. Inclusive of the ones that do not have the connection to internet, do not have connections to what is being talked about or where they can go to listen to this. If I, like I said, if I was back in the community 2.5 hours north of Winnipeg right now, I would only be talking to you through the microphone. You would not see me because I would be cutting in, I would be cutting out, I would be breaking up, which is unfair. As I go only 30 minutes south of the community, I have perfect internet. How is that fair? So when you're doing all of these, like Paula said, it's being mindful of your audience, being mindful of what we're going to do. Like Annabelle says, we have to, how do we do this together? If we want to talk about our health, we would expect people to listen to us, but that doesn't happen. As an Indigenous person, everybody decides what's best for us. So, and especially when it comes to this hybrid way of doing things right now, you think by meeting like this, they think they know what's best for us this way. But if we don't have the proper connections, how do we do that? And also in the communities, most of the communities do not have a nurse or do not have a doctor. So when we're talking medical stuff on this hybrid way of things, especially with medical teleservices, how are we supposed to be able to do that? How are we going to do the things that are recommended by the health services that is recommended online? And when we don't have a nurse, when we don't have a doctor in our communities. So it's how we go forward together, how we work together, and how we're going to do this. This is one way, but it doesn't mean it's the only way. So when we talk about the hybrid mentality of meeting like this, it might work for you, but be mindful, it might not work for that other person. So we got to find a way to go forward together. And listening to each other's voice is one thing, but when you can feel each other's spirit, which we are, as we say as Indigenous people, you can feel certain things when you're face to face. You can feel honesty. You can feel love. You can feel the other person how they're feeling. And then you can go, well, I think we need to take a little break. This is a little bit too traumatic or it's too triggering. But can you feel that here on 2 dimensions? We cannot. We only can wait till somebody goes, I need a break. So it's a good thing. It's a good tool. It's a good modern tool, but we also got to be mindful of other people's needs also as we go forward. So miigwech for listening. See, I kept it short, guys. But I mean, I really appreciate for all of you listening, taking the time out of your busy schedule. Miigwech. Currently in the city, I'm attending at the University of Manitoba right now. It's called Indigenous Science and Western Science of how we are going to look at it together. That's with science, technology, EM, and math, engineering and math, but it also talks about health, our ways of knowing of healing and how we're going to work together. Well, the speakers say what I'm saying. we got to get on the land and heal together. We cannot learn in these institutions because it is blocking our energies. So come, sit with us. How come doctors don't come? Sit with us to learn together and help us heal together. So this is just one way when things are the way they are, but there's other ways of knowing, as we say. Two eyes seeing. Western science along with Indigenous science and how we go forward together. So, miigwech.
Thanks, Thomas, miigwech. And thank all three of our panelists for sharing their insights, perspectives. We can see just how different, I guess you could say, different other people's needs are. So I'm going to open it up now to questions, discussion. Anyone who wants to, share their own experiences, their own perspectives, or has a question for one of our panelists or ourselves, please go ahead, raise your hand. You should be able to unmute. Yes, you are able, or you can pop it in the chat and I can share it on your behalf. Katie,
everybody.
hi.
Yeah, hi. Thanks so much for having me today. My name is Katie Bain, and I work at the Canadian Donation and Transplantation Research Program. Our acronym is CDTRP. We work with a lot of patient, and we call them patient and family donor partners, and we are planning our annual scientific meeting this year, and we're having probably similar kind of struggle that a lot of organizations are having. Do we have only virtual? Do we have only in person? Do we have a hybrid? And we know that if we have in person, we're going to exclude a lot of folks. We have our patient family donor partners, a lot of them are immunocompromised, a lot of them are not going to be comfortable to travel, but we have pressure to have an in-person meeting. So we're probably going to, and I see my colleague Stephanie is here too, and then she's laughing at me as I tell this story. So we're probably looking at a hybrid option, but one of the things that we really want to make sure is that the people that are participating virtually have a positive experience, because we don't want it to feel like they're not engaged and there's not a space for them and that they're just like there. And I think that was the reason that we came today. So thank you, Paula. Thank you to all of you, but specifically the comments that you made, Paula, really resonated me about like feeling like you were sitting on the sidelines. And I wonder if anybody has maybe some more practical tips that we could take into our planning.
Paula, I see you unmuted. You go ahead. No? Annabelle or Thomas?
Have you spoken
Yep.
to others in the medical model who have had a hybrid? BC is really good to talk to. I got some contacts there. The people I deal with in Britain, they might be able to give you. I don't know how you network, so.
I can put my email in the chat here.
There's probably others who might be able to.
There must be there's lots of others. I'm imagining that are in similar types of
situations. And they
situations.
have done this in the exact same medical framework you're talking about. So it might.
So we're a research network. So it's
so you can let me, like, if that's helpful. And just speak to them, and that you might glean some stuff from there. Okay.
Thanks. I really liked, Paula, your comment about having a screen so that the Zoom box, so that everybody could see the Zoom box. I hadn't even thought of that. And I think that's really clever.
Yeah, the other thing you can do is have everyone like have their own computers or be on their phones, but you have to be very, very sure to be muted, because otherwise feedback is going to be awful. But that way everyone would at least be able to see all of the comments as they're coming in. But I really think that it'll probably be easier to have one big screen at the front. Make sure everyone is seated in a circle around, so that way they're right at the front of the group, so they're sort of in a circle, you know what I mean? Just all of those sort of things to just make sure that their presence is physically felt. The more that you can do that, the better, I think, without having like mannequin bodies with our faces.
Thank you.
Well, I would go back and ask the people you think you are leaving out how they want it. because we always assume as people who are presenting, we know what's best. You know, and we gotta, the people who do are going to be impacted by any kind of research or presentation is usually the patient or the caregiver. And if we can't participate, we feel excluded. It's good to have lots of information, so send it out to them before the meeting. What is going to be talked about, especially in this new way of we're dealing with hybrid. When you're asking about who do we need to talk to, why do we need to talk to other people when we have our own mind and our own heart of what the way to do things. It's good to see that, but you need to trust your own self in order to be able to share the right words. I always say, why can't we set the precedents? Why do we need somebody else to set the precedents for us? Why do we need somebody else to tell us what's best for us? We can do it. It's just a matter of not being afraid to take that step. That step is always the hardest to do. So you're on the right track, you're on the right way, but just do by reaching out. There are people who will want to attend, which is bonus, but there are going to be people who want to be on this, and that's okay. It's just a way of making sure when we talk that we're mindful of everybody that is out there. May it be virtually or may it be in person. So just the mindfulness and awareness of what you were talking about. So
Thank you. That's really good advice. And I think like we probably have a couple people in mind that we know would feel strongly against traveling in person. So it would be a good idea to chat with them to see what their thoughts on a hybrid and how it would work so that they could be included. Thank you.
One other thing we found helpful is we do like meditation or something before. Like the meeting isn't just like someone walking into the room and slamming paper down on the table. So I think there's lots of ways to introduce energy so that the tone is set before some of the actual mechanical work is done. I found that very helpful. I've been both a participant and a deliverer of that as well. So.
And I just wanted to add some discussion from the chat. I'm trying to be a good facilitator here. Carrie and I think Susie were mentioning having a facilitator specifically for those who are participating virtually has been helpful for them. And it's interesting too, I'll comment on the fact that so many people have done this and tried this, but when you go to, like I literally Googled hybrid patient engagement and found nothing. So obviously it's a really new way of working for us, but it's tough to find. And then also Carrie mentioned, you know, if you're doing a workshop session, that facilitator could bring those folks who are joining virtually into their own group and they could discuss together and probably make it less difficult for the mix, the hybrid. Paula.
That's a really good idea, having all of the online people be in their own breakout room. I think that would probably work a lot better, because I was wondering, like, now you're gonna need a whole bunch of different screens, like, you know, one for each group. So yeah, that's a really good idea. I like that a lot. The other thing I was going to say was, you know, you're talking about not being able to find anything for patient engagement online yet. I'm sure that'll come, but I don't think you necessarily need to look for patient engagement. You need to look at hybrid meetings in general and then just adapt it for this. I think that might help, at least until it's a little more popular and a little more developed. Because I mean, I can tell, like, I only started with CHI roughly a little over a year and a month or so ago. And I can tell you there's been a whole bunch of, you know, improvements just over that past year. So it's gonna come. It's just a question of when, how easy, and basically to start, just steal the info for meetings in general. You know, just go for it that way.
But I also forgot to add is that English is a second language to me. So is French is a third language to me. So we got to remember, especially within Canada or any of the provinces, that English and French isn't the only nations that form Canada. I'm speaking from an Indigenous perspective. Our languages were here for 12,000, 20,000 years. So when we don't answer right away, we are thinking in our language how to answer either in French or in English. So we got to translate the word that is best, appropriate to either the two languages that are recognized by the colonial or settler peoples without disrespecting them at the same time. So we got to be mindful of who we have online. Also, are we going to have translators? Are we going to have those translators only in French and English? Are we going to have the local communities? We started with a land acknowledgement here. And if you've seen by the nations that were spoken of, that is just scratching the surface of the people that were here previously. So that is just to create that awareness of what I'm saying. Understand who you're talking to, respect that. And if you don't have a translator for the Anishinaabe or the Innu or the Anishinaabe and Innu, you reach out to the community and ask if they can translate for you while you're doing this. We're building those bridges. It's not wrong to ask for help because we all don't know everything. I know nothing. I know about this much in my life of what's going on, and I'm still learning. But just reach out, and that would be the best way if you're speaking to an Indigenous community. Reach out. There's nothing wrong to reaching out. So, miigwech.
Thank you both. Paula, did you have something to add to this? I just wanted to go to Diana for their comment.
Yeah,
question,
sorry,
but-
it's just one
yeah.
more question.
Yeah.
Comment. For Thomas, you're completely right. And it won't just be Indigenous languages, but it's going to be everyone whose first or main language isn't French or English. But in particular, I'm just thinking of people who use ASL, like how that's going to work, because you can always use like there are phone lines that you can use for translation, but obviously with ASL, that's not entirely helpful. So how is it going to work if you have, say, two different people who need ASL? One's online, one's in person. So maybe for those people, having it on their phone would be helpful, because that way, you know, I'm just trying to think how it would work, but that's definitely going to be an issue. And you know, Thomas is completely right, you know, about all different languages and colonialism. And so I think that ASL in particular, though, is going to be a bit trickier.
Yeah, definitely good point. And I can't wrap my head around that as now. That would take some emphasizing the importance of conversation with the people you're going to work with, right?
I think for that, it would be handy to have the person, both people have it on their screens, and the person who's in person. That sounds so ridiculous. We've got to figure out a better way of putting that. So have that, I think maybe have it on their phone and just have them put it on mute, since obviously not going to be an issue for needing it, and also get rid of the feedback. Sorry, Dan, I apologize for talking.
Well, hi, I'm a patient partner in Saskatchewan, but I really agree with Paula. This, like, COVID has really given me the opportunity to attend many conferences and also get involved probably in too many other projects, because it doesn't require, you know, the traveling to Toronto or Ottawa or whatever. And I think now you've said most of the things I was going to say, but I've noticed from conferences, the one thing, then back to Katie, is whatever, I'm not quite sure, whatever you're using to organize it, like, that seems to make a huge difference. I think there's one called WHAO, WHAO, which has all kinds of features to it, and it breakout rooms, when you go, like just really easy breakout rooms, somebody always there if you get in trouble navigating, you can just click an email. So those are the kinds of things you've said. I've been on some that have had, but that's virtually the ASL. They also had another, and I didn't even know what it stood for, going on translation. And then just back to your like where you are in planning, like hopefully you've got lots of patient partners and diverse patient partners. So ones that can attend and ones that can't, and just listen to them. That's I guess most of the things. But I think you guys all, yeah, you pretty much said everything I was going to say. Okay, thank you.
Thank you. We are fortunate. We do have a large group of diverse patient partners that have very strong voices. So I think that's going to be one of my big takeaways from the planning, is just to check in with more of them about it. Like we sent a survey about, and left a little comment box. We got a couple good feedback. Like we didn't want to just say like yes, no, or maybe. So we're like, okay, yes, no, maybe. Would you travel? And do you have comments for us that we should consider? But I think maybe a couple of conversations on top of that would really help inform our planning.
Yeah, I would just say like a Zoom and a couple if people can't come, you know, that like it really when people are hearing each other, you know, that, you know, oh, okay, I never thought of that, but what about this, that kind of thing. Yeah.
Thank you. This is really helpful. I really appreciate you guys.
Paula. Oh, you're on mute.
Yeah, okay, Katie. I have a couple of thoughts, if you don't mind. You were just saying, like, could you go on mute? Because because I could probably ask something. Yeah. So, okay, so you were saying, you know, do you have any comments and like what we should do? But the thing is, patients don't necessarily know what they need to do these things. I would highly, highly recommend you and anyone else doing this have some specific ideas of what to do so they can say yes or no, because this is so new to everyone and we don't necessarily know what we need until we're in the middle of a meeting and going, no one can hear me, or this isn't working, or, you know, so I would really, really recommend that you come up with a few different things in particular and ask them those specifically.
Thank you. I'm typing at the same time that I'm listening, because I was like, I'm going to take all this back, and yeah, thanks.
Well, that's why it's recorded, right?
I messaged Steph and I was like, oh, I forgot this is being recorded and I'm going to be on the internet somewhere.
Yes, you are. On YouTube. Carolyn.
I was just thinking when you were speaking to one thing that we've learned with hybrid, as well as having someone available solely for technology, so that if something is happening that a partner can directly contact during because I know there's been times where you have facilitators all of a sudden trying to fix technology. So having like a separate person as well that partners can connect with around the technology if there's issues is really important too. Or that's one of our lessons I know we've learned.
Yeah, I mean, it's facilitators and it's tech support that this is going to lean very heavily on. I mean, we all know how frustrating it was, but we're used to being virtual entirely. But you know, I just want to say, like, in particular, it's the fact that now only half the audience is going to have those issues. And it was one thing where everyone didn't like had those stalls or whatever, but now having half of it, so that means that you might want to think about what we should do if the conversation keeps going in person while it has been frozen online. Have a policy about this. Should you wait for how long? How are you going to catch things up? What thing? And one other thing is, if only some people are frozen, what should we do then? If it's only one person? You know, it's really these kinds of finicky little details that are going to be happening right in the middle of when you need to do something important. So I really think that you need to lean heavily on practice runs, and you need to lean heavily on tech support. And having the two different facilitators, one for online, one to focus in person. So that means that now having any of these events is going to be more expensive because you need more staff people doing this. So I want you to you should definitely be considering that when it comes to budgets.
So many fantastic insights, Paula. I'm madly taking notes. I'm going to have to rewatch the recording for later when we have this conversation with our collaborative partnership in the future. Bryn.
I think after 2 years, I'd be figuring out how to unmute myself a lot quicker than that, but here we are. Thank you so much, Erin. This is amazing. I've been feverishly taking notes to share this immediately with everybody I know online. I was just going to echo Paul. I mean, I was actually the tech person for, we hosted a James Land Alliance a partnership, but all during COVID, during the last couple of years. So I was their tech person, and what we did is we actually had a script, like, okay, at this point, this is what's going to happen, and this point, this is what's going to happen. It allowed for flexibility, but it kind of cued me into, okay, well, at these points, this facilitator will be in this room and do this. So just even breaking it down, it's a little more upfront planning than we're perhaps used to, but nobody noticed it because it just went seamlessly, because people knew, oh, they have my cell number, they have this, they can contact me, like you said, Kevin. So I just wanted to echo that and just say the script is also, if you can take the time to build that out as well and rehearse it, like just walk through it. It's like a table read, I guess, what they would say. Thank you so much for this. This has been amazing.